Good morning, all of you. So, today we are going to discuss a case study. So, the patient's name was Mrs. Jabunbi. She was 41-year-old female and she was tailor by occupation, live in Khajrana, Indore. And she was come to me at the 1st of July 22. And her present history was neck pain since 1 year, but severe and radiating pain since 1 month. Mode of onset was insidious onset, and site of pain was neck pain and right upper limb pain, and she has back pain as associated symptoms. She has no significant past medical history like hypertension, diabetes, or any other diseases. If we talk about the pain history, then location of pain was neck and right upper limb pain. Type of pain was radiating and aching pain. Mode of onset was sudden. Intensity of pain was 8/10. Duration of pain was since 1 month. Guys, this was the duration of radiating and this was the duration of radiating pain, but she has localized neck pain since 1 year. And aggravating factor was prolonged sitting and overhead activities, and relieving factors was lying. And in personal history, she has no significant personal history, and she was financially stable, and she has good environmental history. On objective assessment, her body build was mesomorphic. Attitude of limb was right upper limb is adducted and protective. Hiking of right shoulder was present. Her gait was normal. Posture in sagittal view was forward neck, right round shoulder, increased lumbar lordosis, and anterior pelvic tilt. On palpation, her skin texture was normal, temperature was normal, tenderness was present on C5 and C6 spinous processes, trapezius and levator scapulae muscle, swelling was absent, crepitus was absent, tightness was present on pectoralis, upper trapezius and levator scapulae muscles. On examination, she has a restricted and painful ROM of neck and shoulder, and on registered isometric movement, she complained of pain on registered neck extension and right side of flexion. On examination, I have examined the myotomes, so there is no significant difference in right and left side of myotomes. And on dermatomes, she has diminished diminished sensations at C5 and C6 levels. And on functional assessment, she has difficulty and pain on functional activities like looking up at the ceiling, overhead activities, and weightlifting. On a special test, I have applied the cervical quadrant test, which was negative, a brachial plexus compression test, which was also negative, Romberg sign or Lermit sign test, it was also negative, Sperling and Jackson's test was positive, and distraction test was also positive, and jump sign was negative. On the basis of evaluation and special test, the differential diagnosis may be brachial plexus injury, cervical myopathy, trapezitis, and cervical spondylosis. There was no significant investigations present like X-ray or MRI. And on the basis of evaluation and special test finding, the diagnosis may be cervical spondylosis. So on the basis of my diagnosis, I have made this physiotherapy protocol for the patient. So my goals was pain relief, reduce muscle tightness, and improve ROM as a short term, and my long-term goals was improve muscle strength, improve functional level, and on the basis of evaluation and goal setting, I have made my intervention. So I have divided it into two phases. In phase 1, I have applied the tense as a modality for 10 minutes in linear pattern. I have performed the exercises like McKenzie exercises, mainly the cervical retraction exercises. I have given the manual traction and CBR, and I have included the chin tucking exercises and hot water fermentation as a home protocol. And I advise the patient to avoid prolonged sitting. And in phase second, I have included the tense as a modality and chin tucking exercises followed by neck extension, neck and shoulder ROM, ULTT of median, radial and ulnar nerves, shoulder bracing exercises, trapezius, ischium and levator scapulae muscle stretching, cat and camel exercises, and shoulder retraction exercises for posture correction. And after the 10 days of treatment protocol, my outcome measures was according to numeric pain rating scale. It was a 3 by 10, and there's also improvement in the and cervical ROM. So this was the original prescription of patient, and thank you.